Brookhaven Hospital is a little unique in the sense of its TBI population because people come to us and generally they have what's called the neurobehavioral syndrome, and they have failed at a lot of other levels of care. The majority of people that come to us have usually a pre-morbid history of psychiatric issues. They also usually are from a lower socioeconomic status. They also have many of our patients have been removed from their homes. The families are not really involved. They have guardians, and they have significant abuse histories, probably a significant neglect histories. And then they've somewhere along the line experienced a traumatic brain injury, and that also precipitates sometimes personality disorders, major depressive disorders, maybe PTSD as a part of a comorbidity for their TBI. It's an inpatient psychiatric hospital, and we have a unit that focuses on traumatic brain injury as a part of a comorbid psychiatric appearance. And the average length of stay for us really has to do with, one, their severity, I think, which is very, very severe. Maybe not a sense in the mild, moderate, severe of TBI in general, but just severe with behavioral issues. And then I think the second part of that has to do with a lack of placement after receiving our services. I can think of a couple of cases recently where we had patients ready to go back to their home state, and probably not their home, but probably a community level of placement. But the problem with that was there were no resources out there for them to go to. And unfortunately, one of the issues with inpatient is if you don't get them out in the magic moment to where everything is good and on the upswing, there's a very big danger of regressing and going backwards. So we've experienced that on different occasions too, which speaks to, again, the resources available at a lower level of care that aren't out there for many states.